welcome to EXO VIP show for the first time ever here in Dubai. My name is Andreas. I'm the sales director of EXO Care. And with the EXO team here today, we're very pleased to have two very experienced EXO users from Norway, Dr. Trond and dental assistant Helen. And Dr. Trond, you've been working with our solutions for about 30 years.
Yes, that is correct, Andreas. And therefore, I'm very pleased to be here with you and have the opportunity to introduce for you what we call the EXO concept.
And we're going to start with the why. Why do we do what we do at EXO Care? And you might think, well, you're a business, so the goal must be to turn a profit. And that's of course true. We can't deny that. But we are a company that is always looking for the meaning with what we do. Why do we do what we do? And we are very dedicated to our mission. And we call that mission extraordinary dentistry. We believe that to create extraordinary dentistry solutions, there are four things that are important. The first thing is what we call professional dentistry. Now, this is about how we try to facilitate and create an environment where you can focus on the work in the mouth of the patient without having to look away, without having to touch things on touch screens or be disturbed by things in the environment around you. The second is about patient care and offering an environment that is safe and comfortable for the patient. And then there's a matter of ergonomics. EXO Care has been a pioneer in ergonomics since the 70s. And we know that more than 70% of all dentists suffer from some kind of work-related health problem. Whether it's carpal tunnel syndrome, neck pains, or back pains, it's more than 70% of all dentists. So for a long career as a dentist, it's important to work in an ergonomic way. And we're going to try to give you an introduction to our concept and solution. The final subject is what we call economic dentistry. This is about realizing that the practice is also a business and how to operate it efficiently.
When we are thinking about professional dentistry, there are three important elements. It is focus at your working area, the oral cavity, its optimal unit instruments, and its individual solutions. We shall start to speak about focus. Everything on EXO is controlled by the foot and the foot control. I keep my hands free. I do not have to look away to switch things off and on, and this really helps me to concentrate on the oral cavity. What further helps me to concentrate on my work is what we call EXO Instant View. Every time the motor stops, automatically a powerful air blow will dry my working area. I do not have to change to and from the syringe like this, but keep my instrument here, and this really helps me to concentrate on my work. But maybe the most unique feature with the EXO working station is that all unit instruments, as you see here, are centrally placed over the chest of the patient. So before I continue, I would like to show you how elegant the EXO four-handed working technique is compared to the more traditional technique that we all know, where unit instruments are not placed here centrally, but away most of the time at the right-hand side of the patient's chair. Here we shall see my colleague working at the left, the dentist, and we see that they're working four-handed, and his dental assistant at his right-hand side is giving him the hand instrument, and he is focusing all the time at the oral cavity. When they're changing instruments, we see that he is not even moving his head. And the same with the dental assistant. They have centrally placed unit instruments and focusing on the oral cavity. And now to the more traditional technique with not centrally placed unit instruments. Here we see our colleague is starting by fetching his instrument from right, pulling it into his working area, the oral cavity, working, putting it back, and he's repeating this all the time. And as you can see, he has to lose focus to what he is doing. An unique and important feature with the EXO is the possibility to change the amount of spray water. Sometimes, let's say I work close to the pulp, I want a really wet spray, much water, to make sure that I do not do no damage to the pulp. Maybe more than 50 milliliter water per minute is needed. And other times, when I work in the patient's front, I do not want to spill water on either me or the patient, so I work with the dryer spray. Very simple. To change the amount of spray water, I simply tap my foot control. EXO has brought the concept of optimal unit instrument parameters even further and introduced the concept of EXO instrument programs. An instrument program is the predefined set of parameters, that is spray, speed and torque, put together correctly for one specific dental treatment. Here you see the program for a preparation. When I do a preparation, I want high speed on my instrument, I want maximum torque and a really wet spray, much spray through the instrument. With only 2 clicks on my foot control, I can change from one instrument program to another. And here you see the program for an excavation. And we all know when we do an excavation, we might be very close to the pulp, and then we want a very slow speed on my instrument and a very low torque, so I really can feel through the instrument while I'm working from the caries lesion and into healthy dentin. And I want a much drier spray, maybe no spray at all. When we as dentists work with EXO instrument programs, we can be certain that we always have an optimal setting at our unit instrument. There are also specific programs for endodontic treatment and surgery.
We know that some of you prefer to work with a solution that is easy to work with, easy to get to know, and intuitive to use without compromising on the basic quality. We have that solution, and we call that the XO42. For those of you who want to work with instrument programs like Dr. Trond just explained about, we have that solution that we call XO46 with XO SmartLink. Now, XO SmartLink is a software solution that really allows you to individualize and customize your unit to work exactly the way you want it to. I can show you an example right here. This is what the SmartLink interface looks like. If you see here, might be a bit difficult to see, but here's a pictogram of the foot control. You see the icons over the joystick and the buttons of the foot control shows you what will happen when you press the specific buttons. Now, these functions you can change to be exactly what you want them to be. So if you feel I want to have my dental assistant call on this button, or I want to be able to start and stop the suction, reduce speed, whatever it may be, fixed positions of the chair, you can move these functions and attach them to wherever you want on the foot control. So you have a unit that works exactly the way that you want it to. And you can store these settings on your profile, and it's possible to have up to 15 different users on one unit. So now we move to the subject of caring dentistry, and Helen, could you please explain about that?
Yes, I will. I will explain about the 3 subjects: safety, confidence, and comfort for the patient. It only takes me 2 minutes to start the disinfection of suction and water system. The suction placed right into the unit like this, and it starts automatically. All handles and instrument pads are easy to detach and can be put into thermo disinfector or to be sterilized. What's really important is the surface on the unit. It's very smooth and easy to clean and disinfect. And what's new now is the surface is antibacterial, which means the bacterial cannot live on the surface. XO4 is designed so that the unit instruments are parked on the left side of the chair, which means the patient enters the chair. She will not see into the unit instrument. And when she is positioned in the chair, we turn them back over her chest, and she will not be able to see the unit instruments either. Another thing that adds to the patient confidence is XO's unique display on this long article arm that can be taken all the way down to the patient, and the dentist can explain the treatment with the patient. Of course, we have the chair with integrated armrests, a very stable neck support, and XO Scuba. This is upholstered with memory foam. This material is breathing, so when the patient's inside the chair, she will not feel sweaty, and also because of high friction, she will not slide from side to side when she is in the chair. We must not forget the small things, such as the Exo's patient tray, the patient's own domain during the treatment, where she can put her car keys, cell phone, etc.
Ergonomic dentistry. As I said in the beginning, ExoCare has been a pioneer in ergonomic dentistry since the 70s, and we believe that if you want to have a lifelong career in dentistry, it's very important that you work in an ergonomical way. Dr. Tran, could you please give us an introduction to the Exo concept and philosophy on ergonomics?
When you shall work ergonomic as a dentist, you should sit well, you should see well, and you should work well, and all this at the same time. First, about how to sit well. You should sit like we see here in an upright, balanced position, and do not twist your upper body. What not so many know is that the human hip joint can only bend about 60 degrees. So therefore, to avoid injuries to your spine, you should sit like this with an angle about 120 degrees between your thighs and your upper body, like sitting in a horse saddle. And this is what we call the upright, balanced sitting position. Unfortunately, we see many of our colleagues sitting like this with horizontal tights and a rotated, twisted upper body, as you see here. What we want when we work as dentists is that we want to see all surfaces of all teeth without twisting our upper body. And what we do to achieve this is that we as dentists work in different dental positions. We work in the 9 o'clock position, the 10 o'clock position, the 11 o'clock position, and the 12 o'clock position. And notice, to achieve this, we need space under the patient chair. In order to see well, we combine these 4 dental positions with 6 patient positions. 3 for the upper jaw, as shown here, and 3 for the lower jaw. And if we combine these first 4 dental positions with these patient's position, it is truly possible to see all surfaces of all teeth without twisting or rotating your upper body. The optimal working distance is about 30 centimeters. So I say make sure that you lift your patient high enough to achieve this working distance. Very often we see our colleagues are positioning the patients much too low, bending forward like this. In order to see well, we need a strong light that is not interfered by shadow. The light beam, as you see here, should be parallel to your eye view. And if you are working in patient's lower jaw, let's say in patient's front, you position yourself in the 12 o'clock dentist position, and you see that to make a light beam that is not interfered by shadow here, this will require a long arm on the operation lamp, as we see here on Exo Daylight. To work well, then it is important, like I started to say, that unit instruments should be placed centrally over the patient's chest. I reach my instrument without strain and without looking away. Each instrument at the Exo is individually balanced. Therefore, while I'm working, I maintain my tactile sense all the time, and I work without strain either to arm or hand. The right place for hand instruments is at the patient's temple.
And what's new now is Exo's auto return holder. I just let go of the suction hose and it goes back into its place. No longer fall on the floor.
Exo has also offered solution for our left-handed colleague. So if you have a left-handed colleague in your clinic, or is it yourself, you ask your manufacturer to move the suction holder from the left-hand side of the chair to the right-hand side of the chair. And the unit instruments, they can be organized as the dentist desire. And notice one more important feature here with EXO. EXO offers also lots of room at the left side of the chair, so our left-handed colleague can work convenient on that side of the chair.
Many dentists have asked us over the years, why are your workstations more expensive than others? And we say, of course, it's because it's not just a product, it's a concept and a solution. But I think it's also the wrong question to focus on. We believe there are three things that are important. The first is cost efficiency, the second is reliability, and finally to have an attractive practice when we talk about economic dentistry. If we start with cost efficiency, with EXO we have the dual working concept where we use the EXO four-handed technique as Dr. Trond and Helen has showed you previously. But when we showed it to you before, we showed it to display how you can maintain focus on the work that you do without being distracted. So you can do precision work in a small area. But another added benefit is that when you work this way, you can be very, very efficient. If you look at the head of Dr. Trond, as he's changing unit instruments and hand instruments, he's never looking away from the mouth of the patient. So this enables him to stay focused, but also to be much more efficient. It's also possible to transform the workstation into a solo workstation. And Dr. Trond, could you show how it's done?
Then it is important that you change the position of the suction holder from what we call the duo position and pull it back to what we call the solo position. And then you can see how convenient you can work as a dentist without your dental assistant.
So it's very easy to transform and to put it into a solo work position. And why is that important? Well, we did a study some years ago in Denmark where we analyzed the accounts of 1,700 practices to see where are the actual costs on a yearly basis in an average practice in Denmark. And what we found was quite stunning. This part over here, which represents about 60% of the total costs of running a practice, is related to salaries. This part here, the blue part of the pie chart, is the part that is directly related to financing and depreciation on your unit, on your investment in your workstation. So when we talk about investments, it's important to say that it's much more interesting to focus on how you can work with your unit, how you can be more efficient than just the initial investment price. The unit takes up only 9 square meters, so it will fit into most practice rooms, even if you don't have a lot of space. And the next subject is about reliability. We all know that reliability is a key factor. If you have a technical problem, if your unit breaks down and you have to reschedule or even cancel patients, it's not just a nuisance to you and to your patients, it's also a costly affair. We have more than 60 years of experience in manufacturing high-end dental workstations, and we have a team at the factory, a team of certified quality inspectors whose sole job is to test the units that are assembled before they are shipped off from the factory. We support that with a 3-year warranty, which we call EXO Uptime Program, which is your safety for security for maximum uptime. So the final element of what we call economic dentistry is about attractiveness, having an attractive practice. And EXOCare is an award-winning design, but I think on the other hand, I shouldn't be the one to tell you that our units are more beautifully designed than others. You can decide that for yourselves. But I think it's important to consider that this is a unit you might have to work with all day, every day for up to 20 years. So not just to attract patients, but also for yourself to have a nice and attractive working environment. This concludes the brief introduction to the world of EXO, to our philosophy and concept, and I would like to say thank you to Dr. Trond and Helen, and thank you very much for listening. I hope that we were able to convince you that we're striving to live our mission at EXOCare.